Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and today with my awesome, just finishing post-op co-host, Dr. Millicent Rovelo. How are you doing, Dr. Rovelo?
I'm freezing.
I know.
I'm freaking freezing.
It's really cold in here.
It's really cold.
It's cold in Southern California.
It's really cold in Los Angeles right now.
I should have said my icicled co-host. We today are going to tackle a much warmer topic of fat grafting.
Yes, we are. Even though it's freezing, it's below 60 in Los Angeles right now.
It is. I think it's like 53 degrees outside.
Which is just way too cold.
It's too cold, and it's 53 degrees in here. It's actually 59.
It's 59. So instead, we're going to talk about, it's kind of a warm topic, right? Because fat is like blubber. Like it's literally blubber. It's what keeps us warm. So if you don't have a whole lot of it.
Notice I'm not freezing. So what does that say?
No comment.
Good choice.
But it is. Fat helps keep you warm. But sometimes we have to redistribute that fat, and that is what we call fat grafting.
Right. So anytime you take tissue from one part of the body and put it somewhere else, it is a graft of some kind. It can also be a flap, but this is a fat graft because you're actually taking out the fat. Typically, we use a cannula, much like a liposuction cannula. Suck out the fat either into a canister, sterile canister, or into a syringe. Process it in some way. There's many, many, many ways. If you ask 100 plastic surgeons what they do for their fat before they fat graft it, you will get 100 answers.
1,000%.
None of which are the same, and they will all have some sort of way that they like to treat the fat before they re-inject it into another area of the body.
Yes. And so the actual extraction of the fat, like you mentioned, is with liposuction. So standard liposuction techniques, these are little small incisions, usually, a few millimeters. And then we have a cannula, which is just kind of a long tubular structure that's attached to a suction device. And then we do liposuction. We actually suck out your fat, and then it goes into a container of some kind. Like you said, it's processed, it's washed, antibiotics or strained or whatever it is. The idea being that you clean the fat of all of the fluid that might be surrounding it, the blood products, so you just have a nice, pure piece of fat. And then you have what's basically considered liquid gold in our profession because fat has some amazing qualities and it can really transform the areas that you put it.
What's your favorite area of the body to fat graft?
I like the breasts because that's what I do, and I like the face.
Yeah, and I've actually, those are also my favorite. I think fat grafting works great in the breast. I think it works great in the butt, too.
It works great in the butt.
I do my skinny BBLs. Like if you need 200 cc's of fat in your butt cheeks, I'm your guy.
If you need more than that.
Yeah. You gotta talk to somebody else. I only do, like my BBLs are all these like skinny BBLs. But and BBL stands for Brazilian butt lift, just for those of you who are following along at home. But recently, I've become enamored with fat grafting of the nose for revision rhinoplasties. And I just did a revision yesterday where I fat grafted the patient preemptively before the rib graft reconstruction that I was doing, the revision rhinoplasty, because the skin was so stiff and stuck and gnarled up that I felt like if I could do some subcision, cut the skin off of the underlying structures and get some fat in there, that it would make the skin better for the revision rhinoplasty. And lo and behold, it was a home run to do that.
Yeah.
It was awesome. Not everybody needs that. Not everybody needs the fat grafting before. In fact, you can do fat grafting at the time of revision rhinoplasty also in certain instances. But man, did this help a lot. And that's where fat, I think, is really curative.
It's great. And let's talk about that. Let's talk about why we like fat so much. Why are we calling it liquid gold? What is so great about fat? So there is the obvious thing that fat provides, which is volume. So volume where you're missing it. This is the basis of a BBL, a Brazilian butt lift. You're taking fat from an unwanted area, usually, the waist or the arms or the thighs, wherever you don't like your extra fat, and you're putting it in a place where you want to have fat. And so by doing so, you remove it from where you don't want it, you skinny that area down, and then you put it in a larger area where you want it. That's the obvious volume replacement benefit of fat grafting. But fat grafting has so many other properties other than just the volume that it brings. It comes with, we call it stem cells, but it's not stem cells. It's just, it encourages the cells around them to proliferate and to grow. So in areas that have been really damaged, we use it in radiated tissues, radiated breasts, in your noses that may have a lot of scar tissue and poor skin quality, poor blood supply. You put some fat in there and you look at that same tissue again 3 months under a microscope, and you will see new blood vessels have grown into those tissues. So it really has a reparative job, really, of these damaged tissues. So it can act like a therapy as well as just plain old volume replacement.
Yeah, I mean, the volume's great. The all those kind of healing properties of bringing in new tissue, very valuable.
Super valuable. And
yeah,
so
I mean,
it's great.
It changes the game. It changes the overlying skin. Yeah, and that's why I do a lot of fat grafting with my facelifts. I do a lot in the breast. I do after removing. There's a big trend right now to remove your breast implants, and then people want to still have some volume. So you take out the breast implants, put in some fat. It's not the same as an implant, but it does provide some volume. And I have a lot of really nice results from that. The breasts look great. They're obviously smaller, but the volume that you can put in is helpful to at least having some sort of volumetric change after removing the implants.
Right. Well, let's talk about the different places we can put fat, and we've already mentioned a few. But let's kind of go like top to bottom and where we put fat and what the benefits of it are. So we just mentioned that we like putting it in the face. It's great with facelifts. Facelifts are designed to reposition soft tissues, to remove some extra skin, to elevate and kind of rejuvenate the overall look. But one of the things with aging is not just that tissues are falling and responding to gravity. It's actually that you've lost some of the volume of the face, the actual fat in the face, the bone of the face starts to resorb. So you actually do lose volume in places like the chin and the cheek and around the nose. So combining fat with the facelifts is a really great way of rejuvenating the face, because not only are you repositioning and putting things back where they belong, you're also putting in volume where you've lost it. So fat's super helpful in the face. And then,
but I want to add a point to that. One thing that I've done in the last 6 months is I've fat grafted 2 foreheads. And in fact, you saw one of the patients today at the end of the day. And the fat really makes a big difference in the forehead. It's amazing what it did for both of my patients. And they sort of drove it more than me. They're like, can you put some fat in the forehead? I was like, sure, why not?
Sure.
And then I put like 15 cc's, 20 cc's in each of the foreheads. And man, what a difference. It looks great.
It does give you back a little more of that youthful contour of the face. I mean, we do put it on the temples routinely.
Yep.
On the sides, the hollows can get really hollow with age. So that's kind of a standard place to put it. Other standard places in the face are the cheeks, sometimes under the eyes, the chin, the nasolabial fold or the smile lines, and even the upper lip. So really, almost any place in the face you can put it. Now, this is not the time to go crazy with fat volumes. We're not trying to, turn you into like, the mushroom. But like,
the Stay Puft Marshmallow
we don't want that. That's not the idea here. It's really just to replace what you may have lost over time. And it works great.
Yeah, I've seen some people who are just way over fat grafted. That is not cute.
And it's not cute, but it's also really hard to remove.
Yeah.
Particularly in the face where there's so many fibrous bands and dense adhesions and small spaces. It's really difficult to remove fat that's been put into the face. So less is more in the face for sure.
Yeah, I mean, I've fat grafted the neck. I have done the transverse lines in the neck with fat. That's helped. It doesn't go away.
That's a tricky one. The transverse lines are
It doesn't go away.
tricky.
Yeah, I mean, I think You need to iron those. It's just they,
You do
you
it.
can lift them, you can pull them, you can change their position. They're kind of like permanent structures of the
there.
neck. They're not. They're not awesome.
Things like Morpheus and microneedling can
Microneedling
help.
helps, yeah, for
Definitely
sure.
helps. But yeah, getting those creases is difficult.
Décolleté.
Décolleté.
Fat grafting the décolleté.
Is
That
very
gets very
nice.
crinkly and wrinkly and sun damaged and
Ooh, yeah.
gnarly looking after some time. Put a little fat in there. It helps.
Yeah, you can definitely do that. I think you'd have to make the fat pretty thin.
You do. You have to.
Like,
So
really
that's part
filter
of
it.
the nano
Yeah.
fat.
Yeah.
And that's pretty much what I do almost uniformly. Is I pass it through a disaggregator. It kind of breaks the fat down to small droplets, and it does make the injection a lot easier, and you can really smooth things out with it. If you put it in as big chunky fat like you're doing a BBL into the décolleté or something,
Yeah,
it's
it's
not
not
good.
going to work. It's going to be lumpy bumpy. But if you can really get it to a more liquefied form, then yeah, that could definitely be really nice.
For sure.
And then the breast, which we touched on before. There's a lot of ways to use fat in the breast.
Definitely.
You can use it for volume replacement. So someone that may be averse to having an implant, they don't want the idea of a foreign body or have to deal with potential complications. So they want to try fat grafting. Fat grafting works in the breast to provide volume. If you have enough fat to give, and you're okay with doing it maybe a couple times, and you're okay with it still looking like a very natural breast, because it's in no way, shape, or form going to mimic what an implant can do, which is a very full, especially up top, an upper pole fullness. And it is not going to stay high and perky. It's going to sit in your natural breast and look like a natural breast, but just a little bit larger. So fat grafting in this capacity is nice. Like you said, if you're taking out the implants and you don't want to put another implant back in, fat grafting is another way of giving some volume back to the breast. And it's a great idea for doing with just a lift in general. If someone comes in and wants to do a breast lift, combining it with fat, particularly on the top portion of the breast, can give it a little bit of extra oomph and volume and cleavage that you don't have to have an implant for. But it's subtle. It's not going to be a huge change. If you're really trying to go up a cup size with fat grafting, you're going to need probably a couple of rounds of it.
Now, do you do your fat grafting at the same time as your lift, as the mastopexy, the breast lift?
I do.
So do I. And, I am always concerned about the pedicle because I'm fat grafting right into the
blood
tissue.
supply.
Like,
The one vessel
Here.
that's left to your nipple. Yeah.
take this. But, it does. I've not
seems
had
to
any problems
be-
with it. It's been
Okay.
fine. I use
Yeah.
small cannulas,
Yeah.
or small cannulae.
Small
as you say.
cannulas, small syringes.
Yep.
It seems to be okay. And it doesn't seem, the risk of doing it doesn't seem to outweigh the risk of going back for a second surgery. So
Right. That's exactly right.
I routinely do it at the same time. Even if I'm removing it, implant, I'll do it all at the same time. The thing about fat grafting, though, and this is true no matter where you put it, when you harvest the fat and inject it somewhere, that fat is not alive. It is not coming with any of its own blood supply. It is technically kind of a dead structure once you've removed it from its natural home. The way it survives in the very beginning is by sort of drinking blood supply from surrounding fat that already lives in that area. And so every piece of fat that you put in, that you inject, has to be touching normal fat that already is in that area. And so if you put a ton of fat in, all that fat that's in the middle is going to not be touching anything alive, and it's just going to die. And then you'll have some problems. So it's not like you can just take as much fat as you want and inject it to the giant volume that you want it to be, because it won't necessarily survive. So that's why we sometimes have to do a couple of rounds of fat grafting to achieve any desired effect.
Yeah, and that fat that dies off in the center of that turns into scar tissue, and it can what's known as fat necrosis. Necrosis meaning death. So and what'll happen is it won't necessarily pus out, although it can.
It can.
But it will typically scar in, be painful, which I've seen.
Yep.
Fat necrosis is painful.
Painful, it could be red.
Yeah, so you want to do very judicious fat grafting, and I think my concept has always been to really skinny down the fat, if you will, really disaggregating it a bunch. And mostly what I do now is I put it through a nano fat kind of process to get it down, and then decant off all the fluid that's used, the tumescent fluid, to get the fat out, then pass it through a disaggregator and then re-inject it. I don't do a lot. I don't spin. I don't I don't put it in a centrifuge, and I don't spray holy water on it, and I don't do all that. I do put a little antibiotics in it lately. That's not been a problem, but it seems like people are doing that. So I'm like, sure, why not? It's not going to hurt. But you never know. It might. Antibiotics might not be awesome for the fat. We don't really know that yet. But I kind of like to give it a little bit of a little bath in some antibiotics.
You do spray a little holy water.
Yeah, a little holy water, I guess.
A little juju.
A little,
just in cases.
Please live.
Please
Don't
behave.
get infected. Please. But it does really well. Yeah. And I love fat grafting the breasts. I love fat grafting the butt. And I understand that you've been doing some hands with some fat.
Yeah.
The Coleman technique.
Yeah, fat grafting to the hands is fantastic. So this is for hands that are aging over time and have lost volume. And it can be very disconcerting to some people, especially if they've worked really hard to maintain a youthful face and neck. And then they look down at their hands and they're like, oh, gosh.
Those are old lady hands.
Those are my mom's hands. Where did those come from?
Yeah, that's true. They don't look great.
They do. The hands lose volume very quickly. And that's a very kind of sine qua non appearance of older people is that they have very, very thin, bony hands. So you can inject fat in them as well. And that is great. They love that. Again, you need sometimes a couple rounds because you can't just squirt a ton of fat into the hands.
No.
But when it takes and you've had your round or two, it really does a great job at rejuvenating the hands for sure.
Yeah, because it is, it's a very natural tissue. It's not going to be very structural. So it's going to kind of follow the contours of whatever's under it. Skin stretched over your tendons and bones of the hand. It's going to fill it in so it looks softer, more youthful, but it's not going to be block-like or structural that way. So it does work great for those types of situations. There are certain times where people say, oh, would you use fat or filler for this? And there are certain things that I would say, filler is more structural and you got to use it there. But, if I can go to fat, I want it.
Yeah, fat works really, really well. And there is this concept that, you lose so much percentage of the fat you put in. And that's true. The sort of the sequelae of fat injection is that you put this fat in and you see the patients back after 1 week and they are over the moon. They're like, oh my gosh, this looks so good. It looks so good. And that's always where I'm like, okay, yes, but don't get too excited because this is not how it's going to stay.
It's not over yet.
This is not by any means how it's going to look because they're swollen. There's been some traumas to the tissues and the tissues have reacted and they're swollen. So they look really puffed up. So that swelling goes down over 2 to 3 weeks. And that's when people think that they've lost their fat. They haven't. You've just lost some swelling. And so now we're at that stage where the fat's starting to figure out what's going to survive and what's not. And I usually watch the fat up to about 3 months, 6 at most. But by 3 months, some of the fat that you've put in has reabsorbed. I tell patients about 30% of what I put in just doesn't survive. It gets flushed out by the body. And then you keep about 70%. And for the most part, that is sort of at about 3 months that I say, okay, whatever you have now is more or less what you're going to keep.
Right, I agree with that.
And then if that's not enough and you want to come back, then I'll wait another 3 months or so and we can come back and do some repeat fat grafting. So no, not all of it stays. And yes, what you see in the beginning is a lot of swelling. And you got to give it a few months to really see what's what.
Yeah, that's kind of how it works. I do give patients antibiotics around the time of surgery. Pain control is usually pretty minimal. If they need, it depends on how big the surgery is. They might need some narcotics here or there, and then ibuprofen or whatever else you want to give them. But yeah, it's a well-tolerated procedure. It works well. It does sometimes need to be repeated a year, 2, 3, 4 years down the road, if depending on, you have to, plastic surgery and aging are sort of like an ongoing duo, and you have to use it as you go. And there's nothing permanent about aging. So just because you do some beautiful fat grafting doesn't mean it's not going to need to be refreshed in 2 to 3 years. That's kind of the way it works.
Well, that's the thing too, is that wherever you put the fat, it's going to behave like fat anywhere in your body.
That's right.
So if you gain weight, you can gain weight in that area. If you lose weight, you can lose the fat in that area. It behaves like the fat, and actually, funny enough, which is nice, is that it actually behaves like the fat from the area you took it.
That's true.
So that's why it's called stubborn fat. So if you're someone who historically gains and keeps fat in your midsection, then that is a great fat to use because wherever you put it, it's probably going to stick around in that place too. So it becomes part of your body. And if you age, if you gain weight, lose weight, it's going to respond the way the rest of your body does. Post-op care is, as you mentioned, a little bit of pain control. Any area you put fat on, I do try and prevent any kind of undue pressure on it.
Right.
So
you don't want to squeeze on the
You don't want to
grafts.
squeeze it. For about 2 to 3 weeks, I say don't sleep on that side. Don't wear a tight bra if we did fat grafting. There are special garments for fat to the butt. Like, just keep the pressure off of it. That's where women don't sit for a couple weeks after the BBLs, because you don't want to put pressure on the fat and then have it die. But after about 2 to 3 weeks, it's integrated pretty well. It's got its blood supply going, so you can start to behave like normal. And then I guess the one last thing or last caveat I would like to talk about with fat grafting is that depending on how you decide to proceed, fat grafting alone is not necessarily a liposuction procedure. So I have some patients that come in and we're doing fat grafting to the breast, and they may have a fair amount of fat on their abdomen or wherever we're taking it, and they think that they're getting a liposuction procedure out of their abdomen. I'm not.
They're getting a fat harvest.
They're getting a fat harvest. So I'm only taking as much as I need. And again, I can't take a whole lot if I'm putting it into the breast or someplace which is kind of a small volume area. I'm just taking what I need. If what you are looking for is an actual liposuction procedure of your abdomen, that is a whole separate procedure. The techniques are the same, but I approach it much differently. If I'm doing liposuction procedure of the abdomen, you're booked for liposuction, you paid for liposuction, I'm spending a lot more time and really skinnying you down as opposed to just taking what I need.
Yeah, that is a huge, they think, patients always think like, oh, so you're just going to suck all this out? I'm like, no, I need like 5 cc's for your nose. Sorry. If you'd like me to suck all that out, we could talk about that. But that's like, 2 hours and 3 hours more of surgery. I'm going to take 5 cc's of fat and inject it into your nose, and you are not going to be any thinner.
Nope.
And they're like, what would it take to be thinner? I was like, just
a few more hours of liposuction.
A couple more hours of lipo, and we'll do it. That's for sure.
Yeah. So
that's a good point, and very, very important to know.
Yeah.
Thank you for that one.
Unless you're doing a BBL. And if you're doing a BBL, usually you do try and
every bit of fat
from the abdomen that you can, because the whole idea is to skinny the abdomen and enhance the buttocks.
Absolutely. There's people just want that. They want that booty. It is a thing right now, and
it's not going anywhere.
No, I thought it would have kind of calmed down by now, but there's a real drive for some width and some projection and some bounce. It is a thing in the entire on the globe. Yeah. People really are into it.
Yeah, and we love it. We love all kinds of fat grafting, from the head to the toe. So that I think that pretty much covers what you need to know about fat grafting.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast, coming to you literally from the 90210.